I'm getting ready to enter my patient's room for the first time today. I have checked her door to make sure that she doesn't have any flags or markers such as fall precautions or any isolation. She's done standard precautions, so I'm just going to use standard precaution protocols. I'm going to enter in the room, perform hand hygiene. Good morning, Miss Wallace. My name is Emily. I'm going to be your student nurse today. Can you go ahead and tell me your name and date of birth, please?
Graham Wallace, January 20th, 2006.
Great. And Miss Wallace, do you have any pain?
No.
No. So just to be clear that you, on a scale of 0 to 10, 0 being no pain at all, 10 being the greatest pain you've ever felt, you're at a 0, correct? Okay, great. So I'm just going to begin my system assessments. Right off the bat, I've gotten a chance to take a look at her general appearance. Her facial expression is appropriate to the situation. Her body position is relaxed in supine position. She is alert and oriented. Her skin color is nice and even toned, consistent with her racial background. Her nutritional status, it has a healthy BMI. Skin turgor is good. The next thing is her speech, which is clear, articulate, based on the brief conversation I've had with her. So I'm going to go ahead and begin the neurologic system assessments, moving into respiratory, cardiovascular, and so forth. So Miss Wallace, can I go ahead and have you squeeze my hands, please? Okay, thank you. Go ahead and pull my hands towards you and push away. All right. Can you lay your legs straight, please? Pull your toes to your nose and push towards me. Perfect. Thank you. Okay. Her motor response and verbal response are appropriate to the situation. Miss Wallace, I'm just going to have shine a light in your eye. If you can just keep an eye on my nose. Watch my finger. Good. So her pupils are round, equal, reactive to light, and accommodation. I've already tested her motor, lower and upper motor strength. So I'm just going to test her ability to swallow at this time. Miss Wallace, have you had any difficulty swallowing?
No.
Okay. Can I just ask you to take a small sip of water for me? Let me go ahead and sit you up. All right, thank you. Okay, so I'm going to go ahead and listen to you at this point. So I'm going to begin my respiratory assessment. I'm going to listen to the anterior part of the chest first, listening to all 3 right lobes and the 2 left lobes. So I'm going to go ahead and do that now. Take a deep breath for me, please. Great, thank you. Ms. Wallace, can I ask you to sit up for me? For the posterior lung fields, I'm going to listen to the 3 lung lobes on the right side and the 2 lung lobes on the left side. Take a deep breath for me. Great, thank you. Ms. Wallace, have you had any coughing?
Mm-hmm.
Okay. And when you do cough, is it productive? Do you produce any mucus?
No.
Okay. I'm going to ask you just to take a couple deep breaths, and on the last breath, a big cough for me. Go ahead and take a deep breath in. Through your nose, please. And on this last breath, go ahead and cough. Okay. Any mucus produced?
No.
Okay, great. So if any mucus was produced, I would check the color and consistency as well as the amount. I've already noted that she is not currently on oxygen. Her respiratory effort is effortless, so I'm ready to move on to my cardiovascular assessment. Ms. Wallace, I'm just going to listen to you again. This time I'm going to listen to your heart. So I'm going to start by listening to the heart valves. I'm going to listen first with my diaphragm, then move on to my bell. I will start with the aortic, then move on to the pulmonic, tricuspid, and then end with the mitral. When I finish with the mitral, I typically will just move and listen to the apical pulse as well. Okay. Just going to listen with my bell. Great. So a few things that I noted while I was listening. No murmurs were ausculted at this time. Also, her apical pulse is regular and the heart rate is about 80. So I'm going to go ahead and check the capillary refill time. Can I just see your finger, Miss Wallace? I'm just going to squeeze real quick. Great. It's less than 3 seconds. I'm just going to take a look at your feet right here. I'm going to check for pretibial edema. No edema noted. Okay. Now I'm just going to palpate for pulses on her dorsal pedis. And her posterior tibial pulses. They both feel nice and strong. They're equal bilaterally. So next I'm going to move on to your abdomen. Just going to take a look at your stomach. Okay, so just taking a look at her contour. She has a flat abdomen. The skin is equal and consistent. The tone is even and consistent. I'm going to go ahead and auscult for bowel sounds at this point. She has active bowel sounds in all 4 quadrants. Miss Wallace, are you passing gas?
No.
No. Not passing gas?
Oh, yes.
Okay. And when was the last time you had a bowel movement?
Yesterday.
Yesterday? Great. Okay, so now I have finished up with her assessment of the abdomen. Ms. Wallace, have you had any nausea or vomiting with the hospital food?
No.
Okay. She's tolerating her diet just fine. As I've been taking a look at doing my vascular exam and my abdomen, I've been noting her skin tone and just her overall skin appearance. I've already kind of assessed her skin using the Braden scale. She's at low risk to develop any pressure ulcers based on that criteria. She does not have any dressings. If she did have a dressing, I would just inspect that, make sure it was clean, dry, and intact. Her skin is nice, warm, and dry, appropriate skin turgor. So now I'm going to go ahead and ask Miss Wallace, have you had any difficulty urinating?
No.
Any pain?
No.
When you do urinate, what is the color?
Yellow.
Great. And does it have a cloudy appearance?
No.
Okay. Okay, good. So Miss Wallace, I'm also going to just check if she was on any IVs. I would take a look at the IV insertion site, which you just make sure you're looking for any signs of inflammation, any swelling in the area, and any phlebitis. You would trace the line up to the fluids, make sure that it's the correct fluids and the correct rate for according to the doctor's orders. So now I'm going to just finish up my bedside assessment by assessing the activity. So she is, according to the Morris Fall scale, she's at low risk for falls, and so she is ambulatory. I would have a chance to assess her gait, if she needed any assistance and how she tolerated getting up and moving to the chair. If the patient was on bed rest, I would just check the head of the bed, patient's positioning, making sure that they weren't slouched or at an odd angle. And if she was on any SCDs or foot pumps, I would assess those as well. And so that is that for the activity. So Miss Wallace, is there anything else I can get for you while I'm here?
No.
All right, so I'm just going to return the bed to the lowest position. I'm going to make sure that she has the call bell in reach. And if there's anything else, you can just call me on the call bell, and I will leave the room and document all my findings. Okay.